Hello, Trail Seeker, and welcome to another exciting episode of the Learn True Health podcast. This is going to be an amazing one. Dr. Jeff Harris, naturopathic physician and one of the world's leading experts in neurotherapy, is here with us today. You can go to naant.org, that's North American Academy of Neurotherapy, and check out the conference that's coming up April 4th through 7th. Every practitioner needs to know about this, as you're about to hear in this interview. And I just wanted to make a quick shout out also that my book, I published it last month. In case you didn't know, you got to grab your copy. The reviews are just so beautiful. I spent a lot of time very intentionally designing this book using everything I learned from my over 500 interviews with holistic experts, as well as my over 12 years of experience working with clients to help them achieve their health goals and their goals around joy, fulfillment, and leading an overall better, happier life, more satisfied life. I made it very simple to use. It's a workbook. So you use it 10 to 15 minutes in the morning, 10 to 15 minutes at night for 12 weeks, and you will build foundations of health. No matter where your health is right now, whether you're just starting on your health journey, you're frustrated and you want to take your health to the next level, or whether you're like me, you're a health nut and you're always looking to improve, there's always room for improvement. No matter how old you are, there's always room to become even healthier, right? And no matter how young you are, there's always room. No matter how busy you are, if you say you don't have enough time, that is exactly why you need that book, why you need my book, Addicted to Wellness. It will help you get the wins, collect the W's every day. You'll stack win upon win upon win in very quick ways that'll motivate you. And no matter where you are, a lot of us kind of get stuck sometimes, or we say fall off the bandwagon. Oh, I hear this so often from clients. I used to drink more water, or I used to exercise. Especially what I'm hearing, the feedback I'm getting is the pandemic. We're all kind of like coming out of our caves, right, from the last 4 years. And so many people have told me that they felt like they were on track with their health prior to 2020. And we had so many disruptions that a lot of good health habits disappeared, and some unhealthy habits, new habits got created or exacerbated. So with my book, Addicted to Wellness, I will guide you and teach you, and you will learn, but not cerebral. It's not so like head knowledge. It's where rubber hits the road kind of knowledge. The experiential kind of knowledge where you'll start tapping into yourself and that self-awareness. It raises more self-awareness. And so you'll feel more and more motivated and excited because you're going to go, oh, wow, I did this little change, this one little health habit today, this one little thing. And I got more energy. I got more mental clarity. I had better sleep. I had more stamina. I had more joy. I felt better in my body. I had less pain or no pain. I can teach you these little habits that you implement and you track, and it's so simple. You can do it anytime. If the busiest person in the world can do this book, so you can do it. So if you want to take your health to the next level, you raise your hand. Who wants to take their health to the next level? If you want to take health to the next level, get my book. It's fun, it's simple, and it is the foundations of health that everyone is missing. You're going to find there's some things in this book you're like, hey, I already do that. Cool. And you'll learn a little bit more about the benefits of the activities you already do. And you're like, hey, that's so great. Okay, keep doing that. But you're going to find that there are health foundations of health and health habits maybe you didn't even know existed, or you thought were too complicated, or you didn't know how to implement. And I make it super simple. I take something profound and meaningful for your health, and I make it simple so that you can do it each and every day to build yourself up. And the feedback that my readers are giving me, they've already started the health challenges, and they're already seeing big wins, huge gains. So I want you to get my book because I want you to achieve those health gains too. And I do it too. This was part of my health journey as well, that using the concept of these small, doable, but profound challenges, weekly challenges, to start to build momentum. So you're going to find that you get great momentum, and it's a wonderful gift as well to give to a friend who's suffering, because the book matches wherever you are, whether you're, like I said, a health nut or whether you're just starting out. It's going to match where you are, and it's going to help take your health to the next level. You can go to learntruehealth.com and click in the menu. It says book, Addicted to Wellness. Just click there, grab it off Amazon. Come join the Facebook group, the Learn True Health Facebook group. I'd love to see you there. I'd love to hear from you. If you have any questions, we're here to help. I know you're going to enjoy today's podcast. Dr. Jeff Harris is an amazing naturopath. He's been practicing for over 30 years, world's leading expert in neurotherapy. It's phenomenal. I can't wait for you to hear it. You can go to jeffharrisnd.com. ND is a naturopathic doctor. jeffharrisnd.com is his website. And to check out more information about the conference, NAANT.org, North American Academy of Neurotherapy Conference, April 4th through 7th. Check it out. And if you're listening to this and you can't make it to the conference or it's past April, don't worry. Go check out their website anyway, because they ongoingly have workshops. But this conference is once a year, so you definitely want to jump in. You're going to be surrounded by amazing world healers just like yourself. And I can't say enough good things about this. I'm very excited for you to hear today's interview. Thank you so much for being a listener, and thank you so much for sharing this podcast with those you care about. If you have a practitioner in your life, share this interview. It is very meaningful. If you have someone in your life that has chronic pain, or they have a health condition that they just can't overcome, those like really difficult cases where it's like they've gone from doctor to doctor to doctor and they cannot get on the other side of it, they're going to want to know about this. So share this episode with them, and thank you for sharing this episode with those you care about, because together we are helping people to learn true health. Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 518. I am so excited for today's interview. I know today's interview is going to change lives. That's why I almost have butterflies. I'm so excited. Dr. Jeff Harris, I'm thrilled to have you on the show today. It's going to be amazing.
Thank you. I'm glad to be here.
Before we jump into you, I've got to share a quick story. My husband, and I haven't talked a lot about this. I've talked a little bit about this in the last 2 years, but for the last 2 years, my husband has had chronic pain, and I have had every holistic therapy I could get my hands on, he went through. And he has had like this nonstop, on again, off again, almost daily, and sometimes daily, neck aches like radiate up into the head, and it's trigger points. And we have had him go through, if you can name a therapy, we had him try it. Everything helped a little bit and would shift a little bit, but it would always come back. And there was specific patterns to his chronic pain. And the chronic pain was so bad, it was like migraines. He couldn't think. He often jokes about, please get me a guillotine. Like he doesn't want to die, but he doesn't want his head to be attached to his body. That's how much pain he was in. And we tried everything. I reached out. I've been reaching out to everyone I knew in the holistic space for answers. And one of my naturopathic friends suggested that I reach out to you. And I can't tell you, you are worth your weight in gold, because after almost 2 years, it'll be 2 years next month, my husband's chronic pain has stopped. It's not just for people with chronic pain. It's more than that. So if you're a listener and you're like, well, I don't have chronic pain, so this doesn't apply to me. No. This therapy is saving lives, changing lives, just drastically improving the quality of people's lives. So I wanted to give this little testimonial to set the stage that I think that everyone should listen to this episode, that everyone should learn from you, and that everyone should know about this therapy that I feel like is not very well known, because so many of the doctors and naturopaths and chiropractors and acupuncturists and Rolfing people and everyone that my husband went to, no one suggested this. They didn't even know it existed, and they really need to. So I'm very excited to have you on the show. Welcome.
Thank you. I'm really excited to have people know about this. Neural therapy has been around since the 1940s, and it's been amazing. And one of the I've wondered why doctors can't always figure it out, you know. I'm happy to talk more about it.
You're like one of the world's leading experts in this. And I want to know, how did you even find it? Because it's something that not many people know. But once you do learn it, it's like the tool you are so grateful for having in your tool belt. And everyone who's listening who's a practitioner, listen up, because there's a conference coming up in April. I'd love for you to come do this conference and learn neural therapy. And for those who aren't practitioners, share this episode with your holistic practitioners. They're going to want to know that they can learn this and use it with their clients and with their patients. But how did you discover this?
So the way I discovered it was I have a patient I met down in Oregon. I was working with a Dr. Turska, and when I met her, she says she was from Seattle area, and there was a doctor that she was going to see, and she wanted me to come along and watch. And when I went, the doctor was Dr. Dietrich Klinghardt, and he started to inject the scars. And the first thing that came out of my mouth was, "That looks pretty easy." And he says you should come to my workshops and learn how to do it. And so he had a workshop that was coming up in about 2 weeks. I went to the workshop. There was like 70 people, and I couldn't get in the front row. And so whenever there was a treatment that was happening, that I would walk up to the front and watch very closely, because I had a patient that was going to give, oh, no, excuse me, he wanted to see me on Monday morning. He had had diarrhea for 2 weeks, and he was losing about 20 pounds a week,
Mm.
and it was skin and bone. And he'd been to the ER, he had been to multiple other doctors, and nothing had changed it. I told him that on Monday morning I would know what to do with him, which I thought, realized later, that was kind of silly. Just like, I'm going to stop all that. And when he came in, I did some testing, actually muscle testing, and what I found was there was nothing wrong with his gut, which was surprising. He was having gut issues. You know, so what I did is I started to search around and try to find where the problem was. I looked in his mouth, and he had some pink stuff in this one tooth, and I tested that tooth, and it related to the pain and diarrhea that he was having in his gut. I did an injection into his gum, and immediately all his gut pain went away.
What?
And I was surprised. And I was like, "Oh, good." And he asked me a question, "What did you just do to me?" And I was a new doc, and I thought that, well, my career was over, and I was going to get sued, and everything was going to go wrong. And so I explained in very detail what I had just done. And he says, "No," he says, "not that. Why did all my pain just go away?" And this little dark cloud that was raining on me over my head turned into sunshine. And I was like, "Oh, that's great. That means I need to do the other side of your tooth." So he opened up his mouth, and I treated the other side. When we treat a tooth that has an infection, it only lasts between 4 hours and maybe 2 days. So I told him to go to the dentist. He needed to get that tooth removed. And he did. All the gut pain continued to stay gone. He called me again the next Monday, pretty despondent, and said that, his diarrhea was back. And I had him come in, and then I put some iodine on a Q-tip, and then I put it down in the socket that was there, and immediately all of the pain went away again. And at that point, it never came back. So that was my first introduction to neural therapy actually in practice.
And how long ago was that?
That was 1993.
And since then, you have been using this successfully in your practice. What are some of the most common things that people successfully have resolved with you using neural therapy?
It seems like just about everything. Well, one of the things that I don't, that's not for is cancer or epilepsy. So to know that is an important thing. But I've treated all kinds of pain, all kinds of issues everywhere in the body that nobody else could even touch. And so often when somebody goes to see another doctor, they will they'll do treatments like I'm going to say like your husband. Well, he'd seen it and there's a little bit better, and all those things were important, but the final thing hadn't been found. And is it okay for me to say what we found on him?
Oh, yes, he is given his permission
Okay.
that we can discuss his case.
So your husband had the most important thing on his body when I did my testing was a scar that was on his left side that he got when he was 9 years old.
Hmm.
And when I find that, it's like to me it's eureka because that's the place that if we treat that, then his body has the ability to get better. Okay.
And what's interesting is that the chronic pain started right after his dad passed away, and he had a dental procedure within the same 24 hours. This is 2 years ago. And then the chronic pain started. And it's like someone wouldn't think that that's related to a scar that he's had since he's 9, right? But it was
Right.
interesting to see that there was a lot of similarities between the scar over his spleen and the when he had the neck aches, when he had the chronic pain come about,
Mm-hmm.
and the fact that the tooth they worked on was also related to the spleen. So there was everything was kind of pointing to that scar, but you'd have to know what you're looking for.
And it's on the surface of the body, right? I mean, to me, since I've done it for all these years, 33 years essentially, and maybe 30, if I can get 31, get my math right here. The scars are so often missed because we don't usually think that they're a problem. And scars can cause all kinds of problems in the body. I mean, from the head and neck pain could cause a problem to the spleen tooth that he was having, and then also relating to the headaches, which we found after I did the treatment that his headaches got worse again, right? Like as soon as the procaine kind of wore off.
Yeah, it was very interesting that his headaches went to daily and got worse. But right when you treated the scar with the little needle that you inject the fluid into the scar, I watched as his whole demeanor relaxed and he became very happy, very relaxed. It was a huge shift. And then later that day, his headaches proceed to get worse for a week until we saw you again. But that informed us that we were on the right path, even though it was negative change. It was actually like, it's not nothing, right? And we're tapping into something in his body. Something in his body was saying, "You're on the right track." And we hadn't had that result from any other type of therapy. And so when we came back to you, that's when we were very excited for the next phase so that we could turn off the chronic pain.
So what I saw when he had the treatment is it looked like he went back to 9 years old when the injury happened.
Mm.
And to me, he looked like that cute little boy again, you know, and he got that memory. So the headache came back because there was more that needed to be done. And I remember telling you ahead of time that, we didn't know how it was going to affect the headaches, but it was going to help a whole system. And I knew there was another place that needed to be treated. And because the testing had showed that, but it's not a good idea to do both of those things at the same time. So when he came back, I treated the place in his neck, um, and then that made the rest of the change. I don't know his status now. That was just a couple days ago. Has he had headaches since then?
Not had any. It's been zero.
No headaches.
No headaches.
Good, good.
Zero. Like not even a little inkling. It's been absolutely zero.
Yay.
Too soon to tell. It's only been a few days, but he normally has one every 2 days or every 3 days, so he hasn't had any, which has been wonderful. He's been sleeping deeper. His body is you. I can see, like a third party observer, I can see that he is out of fight or flight, that he is in that rest and digest state because he's wanting to go to bed at night as opposed to being kind of jacked up at night. His body is wanting to go to sleep on time, and he's sleeping completely soundly through the night. I have not, in the last few nights, he's not gotten up, like his body is in healing mode, and it is so cool to see what you do with neurotherapy and to see it on someone who I know very intimately, to see how brilliantly it works in supporting the body's ability to heal itself.
Yes. It gets the body out of its own way. So the scar was an interference field. And in neurotherapy, that's kind of one of the main things we look for. And an interference field can come from a scar. It can come from a trauma that's physical or emotional, and can even be psychospiritual kind of traumas that have to be dealt with. And by doing an injection of local anesthetic or procaine into the area, so we can do injections over an organ like the liver, the spleen, large intestine, lungs. And then the place that I did in his neck is called a ganglion. And we have sympathetic ganglion, which go along our spine, that are part of our fight or fight network. And what they do is they get stuck. They get stuck in the healing process. And by giving an injection of procaine into the area, it helps to reset it by adding more electrical energy to the area and having it come off of line, which is what the numbness does. And then when it comes back online, the brain resets it with its connection, and it's like, oh, these areas need to be healed, and then it allows the parasympathetic nervous system to do its healing. So the injection that I did is called the stellate ganglion block, and it's gotten quite famous for treating PTSD, headaches, stroke, and left arm pain, teeth pain, heart attacks, heart issues. So it does a lot. And the balancing one with that is called the vagus ganglion, which there's a whole school of people that talk about just doing everything with the vagus. They want you to hum, they want you to rub or gag or do something to be able to stimulate that, when we can do an injection into the vagus ganglion, and that helps to reset it with procaine.
Not everyone knows what procaine is, so they're like, well, why do I want you injecting me with this stuff?
Oh, totally. Procaine is a local anesthetic. It was actually invented in about 1901 or 1903 by a doctor that they were looking for something to use for an eye anesthetic, for like eye surgeries, that wasn't cocaine, because cocaine was addictive. And so when they came out with procaine, they would first use it to drip it into the eye to numb the eye for eye surgeries. So it's it's incredibly safe to just put it anywhere in your body. It breaks down fairly easily into I'm going to try. So DEAE and another product that's slipping my mind at the moment. Oh, PABA. And every cell in the body, as well as in the plasma, can break it down.
Oh,
It doesn't have a toxicity effect, which is super nice. And the thing I like to tell people is that it makes you younger, stronger, and healthier, even if you just put it in your hip. There was a whole sanatorium that was in Romania for many years. Charlie Chaplin, Winston Churchill, Marilyn Monroe, and a number of famous people would go there and they would get injections of procaine. At the time, it's called GH3. And they would be there for like 6 weeks. They'd get twice a week, 3 times a week, and then they would be refreshed and they'd be able to go back to work and to their schedules were pretty intense.
wow.
I've had procaine injected in me in lots and lots of places over the years, and people will see me and that have seen me and I haven't seen me in 10 years, and they'll say, "You look the same age as when I saw you 10 years ago. You didn't age." And I said, "Well, procaine is one of my superpowers here." Does that answer the question?
Yeah, it's safe. It's healthy for the body, and then it's a temporary like numbing agent that
Yes.
when you're injecting it by the autonomic nervous system, it creates a reset.
Yes. Anywhere you inject it, it creates a reset.
Mm.
So our autonomic nervous system, it it innervates all of our skin, every organ, everything in our body. So any place you put it, it actually is treating the autonomic nervous system.
So tell me about this conference in regards to practitioners who are listening who are like, whoa, I want a way to reset people because I'm hearing that we could take someone who has insomnia, or someone who has trauma, right? Someone who has a high blood pressure and heart disease, someone who's suffered a stroke. All these things, when you look at it, they're all definitely related to being in fight or flight, to not being able to get that body in the healing mode, right? They're stuck. And
Yes.
I've seen that like with my husband, no matter how much I, attempted to get him to meditate or relax or the massages and acupuncture, all the things we attempted, I could still see that he was stuck in that fight or flight. Like we couldn't fully get his body to relax, even though he was trying, he was consciously trying to get his body to relax. He could not. And then after the neural therapy, I saw the reset. So for all the different illnesses and chronic illnesses that we can go, well, there definitely is that fight or flight element that you're stuck in fight or flight. This is applicable to. So for all the practitioners listening, tell us about the conference coming up and what will they be learning? What will they be able to treat when they leave the conference?
The conference is downtown Seattle at the Renaissance Hotel, and it's going to be April 4th to 7th. The first day is going to be a pre-conference workshop, and we have two of those happening at the same time. The first one of them is a basic training, and in the basic training, you're going to learn the theory of neural therapy and then how to apply it in clinical practice. Well, they'll talk about the pharmacology, how to do injections, indications, contraindications, what kind of responses people have, how to manage the patient, and then safety procedures that will happen in the office. And the main part is really the hands on. So you get to learn how to do these scar injections, and you get to learn how to do what we call segmental injections. And segmental injections can go over the organs. Well, there's like patterns that we'll use with injecting the procaine at a shallow depth, not into the organ itself. And then we also, a really common one that we do is goes around the head, and we call that one the crown of thorns. And our joke is that it's popular at Easter, which is coming up here soon. And so that's what they'll get to learn in the basic training. In the advanced neural therapy, I'm the one that's teaching along with other doctors that have helped me at other workshops. And I'll be taking people through my protocol for the athlete's full body reset. So we're going to go through all the major neural therapy ganglion from top to bottom and reset everybody's body at the that's in the conference. And so the stellate's going to be one of those. There's other famous ganglions that are part of it, which in my world they're famous, which is the sphenopalatine ganglion, the vagus ganglion. We'll do the celiac plexus, the inferior hypogastric plexus, and the stellate ganglion on each side. If we have time, then I'll also include ganglion impar, or possibly the presacral ganglion. But most people don't know where any of these places are. The only ones who tend to know these end up being anesthesiologists, but they don't use these the same way that we do in neural therapy or understand the theories of how to balance the autonomic nervous system so that people can get well from these treatments. So that's going to be the first part. That first day, at the end of the day, we'll also have one of our longtime neural therapy docs, who's also an anesthesiologist, who's going to talk about neural therapy IVs. I should say procaine IVs, ozone, and then other pearls from his practice. Rob Banner is a terrific doctor, has a great education in diet therapies as well, and so I'm sure we'll hear about those. The next day, which is Friday, which we're calling the main conference, we're going to hear from Dietrich Klinghardt and the history of neural therapy in America. And from listening to what he was talking about, we may hear about it in more worldwide as well. Then we're going to have Dr. Perry Peretz is going to talk about neural therapy and taking acupuncture to the next level. So he's an osteopathic doctor that's also an acupuncturist that has included neural therapy into his practice and has had terrific results. And so we're really looking forward to hearing from him. After that, we're going to have actually, he's a lawyer that's going to speak, but he's actually one of the best trained people in how to do O-ring testing. And O-ring testing is a form of muscle testing that ends up being very good and very effective. And it gives you it helps you to find the indications that for neural therapy. And we'll have another type of muscle testing as well for people to be able to learn, because not everybody can catch on to the ones that are there. And then we'll have a guy, Warren Slayton. He's a medical doctor from New Jersey, and he'll talk about enhancing prolotherapy with neural therapy. So he's mixed those two together. More people do know about prolotherapy than neural therapy, but most neural therapists do know prolotherapy. I'm one. The next one we'll have is a dentist that's going to speak, Carl Anderson. He has his talk on focus and the foci in dentistry and neural therapy. And he's got some great stories about how treating the teeth has helped the body, just like my first patient that I had talked about earlier. And then in the afternoon that day, he and I are going to do an intraoral neural therapy hands-on workshop. So he's going to teach how to do an intraoral injection for the sphenopalatine ganglion. And then I'm going to teach the inferior orbital to be able to numb the upper teeth and to treat the maxillary sinuses. I'll be able to do an intraoral training on how to do the vagus ganglion. And then I'll also do a submandibular ganglion. So if anybody's ever had like big swollen lower jaw from any dental work and it's hard to get that to go away, that's what the submandibular ganglion works with. And it's magic. And afternoon, we'll have an update from a doctor from Austria, from Colombia, and from Spain. And at the end of the day, we actually have what we call breakout session, where we'll have docs that are on our board or other ones that are long-term neural therapists that will have a table, and they'll be treating patients or other doctors there that have specific things that they want, or that they want to learn, because we want to have that opportunity for everybody to have a chance. And that's just Friday, and Saturday, I'm going to talk in the morning about neural therapy and two other therapies that I do along with it. One of them is called PIT, which is perineural injection treatment, which is shallow injections of dextrose, which is a sugar that's dilute, so it's D5W, into the cutaneous nerves to turn off pain and inflammation.
Mm.
And it's been miraculous in healing. I mean, neural therapy is miraculous, PIT is miraculous, and putting them both together makes it even better. The other thing that I'm going to be talking about along with neural therapy is called medical Qigong. We've all heard of Tai Chi, and we've seen people in the park, moving the energy and having these different postures and positions. And medical Qigong actually comes from the hospitals in China in the 80s and 90s and early 2000s. China had medical Qigong hospitals all over China. And the guy that I get to learn from, what his name is Jerry Allen Johnson. He got to go to those hospitals and learn what they were doing. And then he wrote it all down, and he wrote 5 books on it all. I mean, it's pretty extensive knowledge. And then he's been teaching a doctorate in medical Qigong, of which there's 16 classes, and I've taken 14 of them so far and been practicing it, 2.5 hours a day or more, because it's just so fun and interesting. So how I work with that with neurotherapy is I'll do a neurotherapy treatment, and now the person is relaxed. Their parasympathetic nervous system is on, and I'll do a medical qigong treatment, which is have them lay down on the table and clean their energy field and their energy system, their physical body, their energy body, and their spirit body, and then set things correct that need to be corrected, say in their energy field. It's kind of like a mechanic, is the way I think of it, and then recharge the energy system. So the organs need to be recharged. There's energy organelles called dantians that need to be recharged, and then I regulate them so that they can be in balance. And then the final thing is we set 3 layers of protection for the physical body, the energy body, and the spirit body. And it's just been amazing. And sometimes people don't know about that part because they usually have so many questions, so that we don't get to that part. And I'll say, if you have more questions, then will take the time, so I can't get to this. And often they'll say, I'm done. I only have this one question left. And because it ends up being so valuable. There's very rarely we have anything that can take these thought forms that we have out of our body.
Mm.
We'll have constant thoughts. I'm in pain. I'm suffering. I have I want this. I need that, or whatever it is. Or there's something wrong with me is even more common. And it can actually take those out and lessen them, so a person can actually put good affirmations in their place. So, and then we have a neural therapy and psychiatry that's happening on Saturday. We're also having Dr. Schwartz. He's going to come and teach us some autonomic response testing, which we call ART, which he originally learned from Dr. Klinghardt and has advanced it himself. We're going to have palpation guided injection technique that's going to be taught by Dr. Richard Nahas. And then we'll have a workshop in the afternoon by Mark Schwartz on how to actually do the muscle testing and try and take people through the, because if you have a test for the autonomic nervous system, then you can find the interference fields that are interfering with the autonomic nervous system. And so that's really important. And then on Sunday morning, we'll have Dr. Rutledge or Dane Rutledge. He's going to be speaking about how to protect your practice. He's a lawyer. He says target hardening, how to legally protect your practice. And so he's got an hour of that. And then Dietrich Klinghardt will give us his neurotherapy pearls of wisdom. And then we have a doctor from Mexico that's going to speak. She's going to be talking about using another technique for diagnosing the autonomic nervous system, which is called heart rate variability.
Hmm.
And she'll talk about that. And then at 11:15, we'll have a doctor from Germany that's going to be talking about gynecological issues and also give us an update about neurotherapy in Germany. We have some of the best people in the world that are coming to this and speaking at it. And it's an opportunity to learn. While it's not a full-on workshop that you're going to get, usually a workshop in neurotherapy is about 3 days. So you're not going to get every single piece. But what I do expect is you're going to walk out of there with the ability to do something in your practice that you didn't do before, and be confident, and you're going to be able to help the patients that are your failures. All of us docs have failures. We haven't been able to get the patients better, and then they move on to somebody else, or we're able to just treat them for, it's like, okay, I have to keep repeating this thing every 6 weeks, every week, whatever, however long it is. And that's as far as we're able to get with them. And neurotherapy is one of the things that can actually break through that. And so usually people have seen other doctors before they see me who have done really good work, put them on really good nutritional programs. They have them on good other types of programs. And neurotherapy just gets to be the one that shines because it ends up it got the scarf, and it got the nervous system back online. But the other things that were being done were actually important and valuable. So that's the conference, and I'm really excited about it. I'm going down today to help do the room set up and pick the foods that we're going to have. We have some really cool vendors that are coming from different places. One of them has injectables for a number of different things. I get some of them I'm not probably not allowed to say that relate to some of the injuries people have had from
From the wacky vaccine, those injuries.
those kind of injuries.
Mm-hmm.
Yes. And neurotherapy has had some good results with those.
Really?
Yes. Yep.
Have you been able to successfully get people out of long haul?
Yes. So with long haul, I use a combination of the neurotherapy, and then I also do the medical qigong. With that illness, it's very, very sticky, kind of like a black tar that gets stuck in the lungs for sure, the throat, but I've seen it all over the body. But it's an energetic thing, and so people don't have a way to really get rid of it because they don't have any energetic skills. And so with the medical qigong, we can break that up and pull that out. I had a woman recently that had that illness really bad, and she had gotten over it, but she was still coughing, and she couldn't even lay down. And so I did the neurotherapy, which we call the infraspinatus respiratory response and the sternal reflex patterns. And it opens up the lungs. And then I did the medical qigong and kind of did a cleaning, a real deep cleaning, and also cleaned the heart chakra and the throat chakra. and shined them all up and refilled her all up. And when she went home, she didn't cough the rest of the day. She slept with flat on her back without any problems. Texted me in the morning and said, "Hey, I'm all the way better." And that I've had that happen a lot.
Love it. Tell me about who can come to the North American Academy of Neural Therapy conference. So, obviously, doctors, naturopaths, but what if can a midwife go? Can I go? Someone who's just like really interested, or do you have to be a licensed, or do you have to be a doctor to attend the conference?
You don't have to be licensed to attend the conference, but you should know how to do. Well, I don't even know. You don't even have to know how to do injections, honestly. But to be able to go and see what we're doing and how cool this therapy is and how important it is really nice. The, so naturopaths, osteopaths, people, acupuncturists have the ability to do injections. In some states, chiropractors have the ability to do injections in some states. And also we have nurse practitioners. We have some PAs, physician's assistants, dentists of different types as well. All of them have injection skill sets. So, and they can actually do them. I think after any surgery, they should actually get neural therapy by the nurse that actually takes them out of, in the recovery room. They should inject on either side of the scar, not into the scar itself, and then come back at 6 weeks and have their scars treated. It would improve the success of surgeries by probably at least 70% because they come and see me or my colleagues, after a surgery that surgeon said went well, but they're having some issue. And all I do is inject the scar, and now that's better. And so there's an emergency room doc that's going to be there that's used it in the emergency room.
Wow.
I have surgeons that use it as part of their surgery that have given me those type of statistics, and we need more. Every doctor should know how to do neural therapy at the level of doing the scars and segmental because it'll improve everything that happens in their practice, and everybody will be so happy with them.
And that's something they'll learn at the conference?
They can learn it at the conference and also have it done. We'll also have a time where there's going to be a couple of medical qigong practitioners that will actually be there in the afternoon on Saturday to be able to get treatments.
I think I would be as a practitioner most interested in having it done to me, so I had the experience of what the patient or the client is experiencing. So that's the exciting part, that not only is it hands-on, that as practitioners attending the conference they'll be able to do it. That's why it can't be virtual.
Yes.
There's so much hands-on work that you get to do. This isn't just a theory conference. This is a get down and
No.
dirty and actually get to do it and then have it done to you by
Yes.
the very experienced practitioners.
Very experienced practitioners that are going to be there, as well as you get to feel how it is from a new person as well. Well, what I found is when somebody just sees the neural therapy, it usually looks really easy. Like if you watch how my hand does it or I'm doing it, after 30 some years, everybody goes, "Oh, that looks so easy." But I've done 10,000 of those injections or more. And so what I do when somebody is learning and they're hesitant and they'll allow me to touch their hand or the syringe, then I'll hold their hand and I'll help guide their hand and tell them what they're feeling in the tissues. We call it tissue palpation. So that as they're going through the tissue, they can actually get some feedback, and then they have a chance of learning it kinesthetically as well as by watching it and hearing it. And some people are kinesthetic learners, and my hand can teach them really well.
So that's the exciting part. I want everyone to reach out to all their practitioners. I know when I get off this interview, I'm contacting every single person I brought my husband to, that my husband went to, all the practitioners who really were eager to help end his chronic pain, but didn't have this tool set. And I just think that there's so many practitioners out there that want to have this tool set and don't even know it exists. So listeners, we gotta together, we need to spread this information, let them know about the conference that's coming up, because no matter what kind of thing your practitioner practices, they're going to want to know about this and to have this as a tool set. And even even people who are just interested in learning more, the fact that you could go to this conference and get treated and learn all this stuff is so cool. These tools are there. It's non-invasive, which I love. It's non-invasive. Are there? Let's talk about. Are there negative side effects? Like, if someone says they're going for surgery, of course there's risks, right? Or they're gonna get on a new drug. There's risks, but this is so different. So what are the things that we look out for, or what are the risks, or is it only like, oh, redness at the site, and that's very minimal risks. Can we talk a little bit about that?
So there's very minimal risk, which is really nice about it. There's more risk with maybe where you place the needle than with the Procaine itself. You know, the Procaine itself will, and the injection on the redness or bruising, on the surface. And I tell people I don't charge extra for bruising because I used to get calls like, "Hey, I got a bruise from that," and it's like, and it's and so it saved me a bunch of phone calls to be able to remind them that bruising does happen. And often I tell a person when bruising is going to happen, I can see it on the surface when I'm doing it. Somebody could be allergic to Procaine. I've only found one of those in 31 years, so that was rare. And I used dextrose instead on them, and I had decent results. Um, Also, there's other local anesthetics that are known, a bunch of them, of course. The one that's most commonly used is called lidocaine. Its other names are xylocaine, and it actually has to go to the liver to be broken down. So there's a toxicity that's fairly low with that, and there's some neurotherapy docs that won't use it at all. I've used it very sparingly. It has a little bit longer numbing effect. It doesn't cause the vasodilation, which is something that I want, and it doesn't have the healing benefit of the anti-aging properties that could be part of it. If you put Procaine into blood vessel, so we can use it in IV, and it's been safe for the heart, it's been safe for the brain. You can get too much, you know, which is kind of, if you injected it directly into an artery that goes into the brain, then the person will have a very short time seizure. And which, when that's happened, they've said it's probably the best neurotherapy treatment they ever have, but they wouldn't volunteer to do it again. So that's, I haven't really had that.
You're palpating so precisely that you're not trying to find the carotid artery.
No, you're not trying to, and you're not trying to, even though in Argentina, they actually were doing injections directly into the carotid artery very slowly. And they stopped that and decided that it wasn't, they were going to be doing that anymore. They'd done it for a number of years in their with their psychiatric patients.
Did they get results with them?
They got results with it, yes.
Like what?
They were having people get better. I mean, we do know that Procaine itself is an MAO inhibitor, which is an antidepressant, which is kind of nice to have. But they were treating lots of different things, and I don't remember what all of them were. But we have a psychiatrist that will be coming to tell us his treatments for his psychiatric patients and how it works.
I'm thinking about the people with long-term chronic depression, anxiety.
Yes.
Anxiety is through the roof. I mean, when we look at the suicide rates, they've gone up in the last 4 years. I saw somewhere a statistic that the younger, like 24 and younger, suicide's the number one cause of death. I'm not sure if that's still accurate, but it is just very depressing and bleak when we think about mental health in the United States. And I don't really know any country that's doing mental health right. But when I'm in the United States, and I'm originally from Canada, so I can say, Canada and the United States is not doing mental health in a healthy way, that we can see the outcomes. People are just put on drugs. I think going to an MD, saying you're depressed, and an MD being allowed to put you on antidepressants or anti-anxiety meds without also having you in therapy, I think that's really I just think it's ludicrous, because it's like, here, let's just mess with your brain, numb your body's trying to communicate with you, your emotions are trying to communicate with you, but let's just numb all that, and don't go to therapy. Don't resolve this issue. It's like we're not giving the patient the tools to heal. Let's just throw drugs at them, which is a crutch, right? It's like, you wouldn't put a cast on a bone that's not broken, but yet MDs are allowed to prescribe antidepressants and anti-anxiety meds like they're candy, and that really messes with people. It doesn't help them overcome.
So I think of them as a band-aid.
Yeah.
So antidepressants are trying to treat a second level problem, which is an emotional and electrical problem with a physical product.
Mm.
And so you give the physical product and it has an effect, but it's always a diminishing return. You get 3 months, 6 months, and then now the person, their neurotransmitters are now even more depleted because the drug has been enhancing them. And now the person hasn't done any of their emotional work. And so now they have the double whammy that the antidepressant isn't working and they haven't done their emotional work. So I agree that if you go on an antidepressant, you have to go to a counselor, get therapy that's effective, because you got 3 to 6 months before that wears off and it doesn't work anymore. And now you'll have more depression and you'll still have the same problem.
So, in terms of neurotherapy, because it's resetting the nervous system, getting them out of that fight or flight, are you seeing that people with depression, or even on antidepressants, or people with anxiety, um, are they able to recover faster in conjunction
Yes.
with therapy? Can we talk a little bit about that emotional or psychiatric experience?
So to do that, I'll have to talk about the 5 levels of healing. Okay. So the first level is physical. So you have, let's say, massage, pharmaceutical drugs, surgery, a whole host of things, blood work, lab work, all is there. So that's the first level. And that's where most doctors are trained and where they actually have a level of competency, in my opinion. So the next level up is the nervous system, the electrical part of us, which is where the emotions are, and emotions carry a charge, and so do interference fields. So neural therapy works on the second level, and whenever you work at a level higher than the level where the problem is, then it always treats all the levels below. So if somebody gets neural therapy and their problems on that same level, then they get better. Okay. The third level is the mental level. So we can have all kinds of things that mentally, you know, I think of them as the programs that got in prior to the age of reason, which is between 5 and 7. We learn these from our parents, we learned them from our peers, we learn them from our environment that we're around. And those programs were designed to have those go in because the people that are around have been successful at being able to have children So we need to be programmed so that we can raise children. Um, but not all those programs are actually healthy. So we need to find those programs which and then be able to reprogram a person. And with procaine treating the interference fields that are below that, it makes it much easier for the mind to be able to face those mental programs in an honest way, so they can actually do the healing work and through affirmations, through mantra, through a number of different ways. There's psychotherapy, there could be homeopathy, and then so that's the third level. Fourth level is archetypal. So an archetype is a symbolic representation. So the kind of the first archetypes that we have are male and female. So we can look across and we see a man, and he has a baby, let's say in a carriage, and we see him pick up the baby that's crying, and he pats the baby and he tries to make the baby happy in some way, and we go, oh, a good father. If we see the man or woman pick up the baby and it's crying and they shaking it, we go, oh, bad mother, we must take that baby away, they could hurt that baby. And archetypes are something that we all agree upon. So good and bad father, good and bad mother, good and bad person, that we'll often go to. The thing that I've liked is that we all share kind of four of the lower archetypes, according to Carolyn Mace, and her last name spelled Myss. She still teaches, and she says we all share the child archetype with the saboteur archetype, the victim archetype, and the prostitute archetype. And we think of these as like, oh, that's bad to be a child. I'm a grown person. But we will see people, they'll talk like a child, they'll act like a child, even late into life. They didn't quite grow up. And most of us go, oh, I don't want to be a child my whole life. Well, the way that you actually work with the archetype is by seeing it and recognize it's there, and know that archetypes have two sides. So the child archetype, when it stays a child, is childish, but when it grows up, it becomes the adult. The same with, say, the saboteur. Somebody, my life keeps getting sabotaged by this, that, and the other thing. Something's always in the way. I can't get where I'm supposed to be. I don't know what I'm supposed to do. I don't know what my purpose is. And the saboteur is like, oh, you have a saboteur. It's like, oh, well, I don't want a saboteur. That's terrible. It's like, no, the saboteur itself, when it's healed, it protects you from being sabotaged. The same with the victim. The victim, oh, everybody's doing it to me. This is a problem, you know, and it's there to blame. They're blaming. And when we blame somebody else, we don't have the opportunity. We can't heal it because we've pushed it outside of ourselves. The healing of the victim is the protection from being victimized. And the same thing happens with a prostitute. We see that, oh, I'm doing this, I'm selling myself cheaply for things, and my spirit is far more valuable. And so I need to actually up my game. And then we end up finding that we're all truly valuable, every one of us. So that's the fourth level. The fifth level is spiritual level. And often we talk about that as being self-healing, doing meditation, focusing on the divine. And there's a whole host of like beings that live in that realm. And we usually think that from that realm, we call it the divine. The fifth one is the divine or light realm. And when that shines the light down through the fourth level, through the third level, to the second level, to the first level, then we actually can have physical healing. The scars and interference fields can be blocking that light from coming through. The mental programs can be blocking that light. Our misunderstanding of the archetypes can be blocking that light. So each one of us has the ability to heal all the way to the spiritual level, but not all of us have the wounding to that level. So some people only need to be treated at the second level. And so for me, neural therapy works on all these physical problems. But if I don't get a result, then I know that I have to go up a level. Up, and then if I go up a level and I don't get a result, then I keep going up a level. In my own case, I had to go all the way up to the spiritual level to get the healing that I needed. And and that's that was my contract, is the way I think of it for when I came into this world.
It's funny, as healers, right? As you're a naturopathic doctor, and I'd see that there's a calling. I hung out with a lot of naturopaths in my lifetime, and I there's a distinction between a naturopath and a traditional medical doctor. Like, when someone's in allopathic medicine, you don't even have to tell me what your profession is. I can pick up, like, who's the holistic healer and who's the allopathic healer. It's just there's a definite distinction. And it's funny how, as healers, we have to have some wounds to heal
Yes.
ourselves in order to develop that empathy with those our passion, our calling is to help others. So the fact that you had to go all through these levels to have your own personal experience, so that then you could inform people on an empathetic level and help them with their healing process. I mean, that makes complete sense. And I've had a similar experience. And for those listening, a lot of people go, well, I can't do what I want to do because I'm not perfect yet, right? Like, I'm not at my goal weight, so I could never, help someone with health. Or I'm not, I don't look like I'm, super healthy. So, or I don't look perfect, or I don't, people wouldn't perceive me as perfect. And this is where I catch people and I go, if you wait to be perfect, you've missed out on the opportunity to help hundreds of people or thousands of people, because as long as you're working on your journey, you're working towards your health. You're going to learn along the way that you'll be able to immediately take those lessons and apply them to others. I think that there's a lot of healing that's going to go on at your conference. I just have a feeling the
Oh,
way it's
yes.
set up. Now, you guys have been doing this conference this has been going on for a while. The North American Academy of Neural Therapy's been around for a while, right? So you've had these experiences at the conferences. Obviously, you're one of the world's leading experts. What do the practitioners walk away in terms of their own personal growth? Can you share some experiences?
So to me, that's what's most important, is that the doctors and people that are practitioners that are there, or whoever it is, gets their areas treated that need to get treated, because all of us need healing. And my I'm hoping, and like when I teach a 3-day workshop on the basic training or the advanced, my goal is to get everybody there treated so that they can actually go back and they're more healed practitioner than they were before. And they have some new tools to be able to work with others. So they get the experience of actually having the injection, and also when somebody is like afraid of it, then they get to have the experience of watching me, how I talk to them to help them make a decision about doing an injection or not. Because I understand that we all have a right to say no. And that's where I start. And I will I'll tell them, this is my sales pitch for on why I would do this injection and why I'd even suggest it in your case. But you still have that right to truly say no. I find if somebody doesn't have the right to say no, then their yes is not definite. And I really want them to be on board and understand, because or be able to say no if they need to. The NANT, NAANT.org is the website. And like all website, it has flaws. We've worked on it so much. It's crazy to do. So usually if you do the contact button on the NANT website, then it ends up coming to me. I'm the current one that answers the question, and I'm the current president of the North American Academy of Neurotherapy. And
I'm impressed with the website.
so,
I haven't found any flaws on it.
oh, you haven't? Oh, good. I was just looking and I saw a couple. It's like, it's kind of, how it is.
Oh, I do. I know how it is. I've been clicking through the conference and looking at all the amazing classes and everything, and I was actually really impressed with the website. So the links to everything today, Dr. Jeff Harris's website, and to the conference are going to be in the show notes of today's podcast at learnturehealth.com. But I'll just throw them out here. So it's jeffharrisnd.com is your personal website. And then, of course, I want everyone who's listening to go to this conference. I just think it's going to be phenomenal. And that is naant.org. And then from there, they should be able to just click right there on find out more or register now for the conference coming up
Yep.
April 4th through 7th. And you can go to the whole conference, which if you're flying into Seattle, you might as well do the whole conference. But you could also just do the pre stuff. There's different options for which things you want to attend.
You can join. You can join if you want to too from the website.
Yeah, so tell us about this.
Yeah.
So I'd like just to wrap it up. I want you to speak to the providers who are listening, and you've mentioned some, but like anyone who's working with clients or patients, anyone who has physically sees their clients or patients and wants to help them on an emotional and physical level and help them on these deep levels, especially the patients who haven't, or the clients who haven't gotten results, who just like they still have the anxiety, they still have the sleep issues, or they still have the chronic pain, or you've worked with people with PTSD and very quickly seen amazing results, right? So if
Yes.
any client or patient who that taking them out of fight or flight and resetting their nervous system so that it is like reset, it's no longer like stuck in that fight or flight, you want to bring them in and to be able to do this therapy with them. So speak to the practitioner who is interested in learning this, possibly joining the NAANT, but especially
Yeah.
those coming to the conference or interested to coming to the conference. Just speak to the practitioner who just learned about this therapy for the first time in this interview.
So there's a thing that's 100%er kind of question for neurotherapy. What happened just prior to this condition that you have to your body, your mind, or your spirit? And most of the time, people don't always remember. So it usually takes a little bit of prying. So they say, so you've had this illness for 5 years. What was happening 5 years ago in your life? What do you remember from that time? What do you remember from 6 years ago? And what was happening in your life? Did you have any surgeries? Did you have any car accidents? Did you have a divorce? Did you have any kind of emotional trauma, somebody die in your family? And if they've had anything that's happened that was a big event, then we know that neurotherapy is going to help. That's how we knew with your husband. We'll bring it around to that. It's like, oh, nobody's treated this scar. And it was a kind of a life and death situation. The aid cars showed up. The older boys that were around, they all abandoned him. It was his friend that was there did run and get help, but he got abandoned. He had to lay there by himself maybe for a period of time, and he's bleeding and he's hurt.
Yeah, my husband
Ah,
30 feet into a riverbed and had riverbed rocks lodged in between his ribs and nearly lost his spleen, He was 9 years old. There's no cell phones, and they were in a park, so his friend ran and got help. And then there was a woman who happened to walk by, and she was the one that was with him. But yeah, it was. My husband says he doesn't remember being afraid,
Oh, good.
but it's like, well, of course we're afraid in that moment. And
Yeah.
he was in tremendous pain, and I think that it's interesting how we bury stuff and how we, when we go through trauma, if we're not ready to process it, we bury it. But the moment you finished injecting the scar, he had a huge reset and could definitely
Yes.
physically see it. And then the next week, when you did the therapy to reset his nervous system, the next injections, that's when all the pain stopped and hasn't come back. And
Yes.
it's like I got my old husband back.
Yes. And if his pain does come back, we know that we could repeat the same treatment and get a longer result.
Right.
Isn't that cool?
Yeah, it is
That's
so
so
cool
cool.
and it's so worth it. And like I said, it's the only thing we've tried probably 20 different therapists, 20 different, I mean, I should sit down and think about everyone we went to, but we've tried everything. And even he went to allopathic medicine, and that didn't work. It didn't even touch the pain, like everything. And
Mhm.
this is what did it. And I imagine so many people out there who are suffering, who we could end their suffering quickly and
Yes.
without side effect, without harm. Thank you so much for coming on the show. I know your schedule's tight. You're preparing for the conference. It's been wonderful having you here, and I'd love to have you back to talk more about this in the future. I urge listeners to share this interview with your practitioners in your life, your dentists, your chiropractors, your doctors, your nurse practitioners, your acupuncturist, everyone who sees their clients or patients in person. Let's get this information out there. Dr. Jeff Harris, it's been
Okay.
such a pleasure.
Hey, can I say one more thing?
Yes.
On the topic of doctors who are allopathic and medical doctors and DOs, they're often so wounded and they never get the health help that they need.
Mm,
Our society, in my opinion, has let them down.
mm.
They spend all their time getting grades, having to learn, these things, and they get brainwashed that this is the only way to do healing, is my opinion. Their relationships that they have are usually not very good. I think that we should actually give them a practice boyfriend or a practice girlfriend as they're going through school so that they can learn about relationship from somebody who's healthy. Um, and so I'm all about helping heal anybody in the medical profession.
I love it.
So I want to make sure that's got said too.
Okay, so thank you. You called me out. I think I've been holding them in a negative light, and I should imagine all the medical doctors and hold them in love and just shine light on them and say, I want all of you guys to
Yes.
heal thyself, and come to the NAANT conference where you could begin that healing. I'm excited. It's going to be, the energy is going to be wild. A bunch of healers together ready to heal themselves and help heal others. What a wild
Yes.
conference.
Yeah, we call it the neural therapy family, you
Beautiful.
know. It's it's a it's a group of healers and we get together and we help each other and flourish and have a really good time, you know.
Wonderful.
Thank you. Thank you for having me. I was glad to find out that you actually did a podcast. I didn't know that until just the other day.
I know. Well, I heard about your conference. We were talking about your conference. And I'm like, hey, can I help you? And I want to get this word out. And, it's just, anytime I meet a holistic practitioner, I'm thinking, I should definitely have him on the show. And I was so grateful that you wanted to come on, because my goal is to help change lives. And that's by spreading information. And I'm just, you're the one changing lives, and I'm just like the machine. The farmer has a machine that spreads the seeds, right? I'm like that. I'm
Yes.
like, let's just spread it. Let's just get it out there, get all this information out there.
Yes. And that's not my skill. My skill is just doing what I do, the treatments.
Yeah, you keep healing people, and I'll keep telling people about how you heal people. So it works out.
Great. Thank you. Thank you for having me.
Wasn't that an amazing interview with Dr. Jeff Harris? Give it up for Dr. Jeff Harris. Ah, I just love this stuff. And I'm so excited for you to share this information with your practitioners. Please, let's help spread this information. I want you to know about my absolute favorite non-toxic mattress. I have done interviews in the past. This is a medical device. It's a medical device you sleep on because they made this mattress so that it aligns your spine no matter which side you sleep on, whether it's your front, your back, your side. It aligns your spine, and it removes all pressure points. This was designed by an engineer who patented it, who it's a medical device that originally, and is still used in hospitals today, but originally was proven to reverse bed sores, prevent and reverse bed sores. So can you imagine sleeping on something so comfortable? It's firm yet soft because it keeps everything in alignment, and it feels like you're floating on a cloud. Like it's so supportive. People who love firm mattresses love it. People who love soft mattresses love it because it's firm, but you feel no pressure points. It's amazing because it collapses exactly where it needs to. It's the coolest thing. And I swear by this. I just love this mattress. Well, they're doing something they've never done before. This mattress has been sold for over 20 years. And in fact, it lasts for over 20 years. It has the best guarantee, the best warranty in the entire mattress industry. It's meant to last over 20 years without warping, without any negative damage. Usually mattresses go every 5 years. And if you're sleeping on a mattress older than 5 years, it's warped in some way because they don't design them correctly. So this mattress has never been on sale like they have a sale going on right now, and I have to let you know about it. It's 25% off. Go to learntruehealth.com/organics. That's with an X at the end, learntruehealth.com/organics, and check it out. You can also, when you go to my website, learntruehealth.com, you can click on what Ashley recommends at the top in the menu, and then you'll see it in there in my list of the things that I recommend. Give them a call. I mean, you could check it out, their website. You can also give them a call. Let them know I sent you because they throw in goodies and stuff, but it's 25% off right now. They usually throw in some really great goodies for my listeners. I have the owner of the company. I had him on the show a few months ago, and he's giving us some great stuff. But right now, huge sale, 25% off. And they do payment plans and stuff. So if you don't like your mattress and you want a new one, or you're thinking about getting a new one, and you're like, well, I don't have all the money to buy this amazing sounding mattress, don't worry. They have payment plans. They have a crazy return policy. Like, I think you can sleep on it for 90 days or 120 days or something. You sleep on it for months. And then you could still return it if you wanted to. So very few people do because they love it, but there's no risk. I love things that are no risk and they help you, and they're non-toxic. It doesn't off-gas crap, and it helps realign your spine and keep it there. My chiropractor was really amazed because she noticed a difference when I went from my old mattress to this mattress that we have now had for several years. We've been sleeping on it for well over 5 years, and it's true. It doesn't warp. It feels just as good as the first day we got it. So learntruehealth.com/organics. Check out their sale right now. I don't know when the sale's ending. You know how sales go. They could have it for a day, they could have it for a week, but they just let me know that I'm allowed to tell you guys about the 25% off. And be sure to mention that you heard it from the Learn True Health podcast, because I want you to get whatever goodies they're throwing our way. They were mentioning pillows or pillowcases or a mattress protector or something cool. So get that organics mattress, 25% off. LearnTrueHealth.com/organics. And make sure you go to Dr. Jeff's website, jeffharrisnd.com. Check out that conference, naant.org. Of course, the links to everything I just talked about today in this episode is going to be in the show notes of today's podcast at learntruehealth.com. Thank you so much for being a listener. Thank you so much for sharing this podcast with those you care about. Have yourself a fantastic rest of your day.